We want to return now to our continuing coverage of our coronavirus pandemic here. Dr. Alex Jahangir with Vanderbilt and Metro's COVID-19 task force joining us again tonight. Doctor, we've been reporting on the parties, the mass gatherings. You've seen these that we've shared over Memorial Day weekend. Tell me, are you worried when you see that?
Yeah, you know, Tracy, I am worried. And the reason is this. We have had such great success in this city to be able to interface to now at a fairly quick time because we've done such a great job at safer at home and social distancing. And now as you start seeing those pool parties in Missouri or things that we saw on Broadway even over the weekend, I do worry because humans are the vectors of this disease. And if we're getting together really close, not taking those precautions, we'll just start spreading this again throughout our city.
That begs the question, the World Health Organization warning about a second wave in the coming months. What impact, if any, is this information having on the reopening process here in Nashville?
Well, you know, we've always been very transparent with what was going to cause us to reopen and also further close if needed. And right now, I'm really happy to say all our metrics look great. Our 14-day trend is actually flat, if not lower than it was 14 days ago. Our hospital capacity is good. Our testing capacity is good. But make no mistake, if all of a sudden we start seeing those numbers head the wrong way, you know, our first priority is to protect the city, and we'll be very clear about that and go back. But nobody wants that. I just want to be very clear. The mayor doesn't want that. I don't want that. So that's why it's very important for every Nashvilleian to do his or her part to try to minimize that risk.
You know, those heat maps we've been looking at came out today. We continue to see spread. Is the reopening of Nashville and Middle Tennessee in general directly linked to some of this data?
Well, we use all that data to determine whether we reopen. So yes, but I will tell you those heat maps, if you notice, they've been kind of consistent in the Southeast. And really what we're seeing is a lot of essential workers are who's impacted by this. And so we have plans in place. I think the mayor's called it a Southeast plan publicly before to try to really minimize that spread. And that's why we increased our number of contact tracers and others and testing in those areas to try to find out who has those viruses and then try to block them off from the rest of the community so that the spread minimizes. So sure, it matters how we reopen based on that data, but so far we felt comfortable that we could do it in spite of what you saw on those heat maps.
You know, you talked about in past press conferences about the mobile testing teams that you have ready to go to head out to these hot spots when they erupt. Have you considered using those teams to go out to mega churches or large office buildings, even college campuses, as more people come back to work or return to school, and maybe even if it's just about the testing there, but using that team approach to go out?
Absolutely. In fact, this morning the mayor and I and Dr. Caldwell discussed that exact option. Is how do we best use our mobile team as we reopen? So you mentioned some sites. We also looked at perhaps maybe shopping centers or areas that are hot spots right now that we could maybe get to people if they're unable to come to our assessment centers. So everything you just mentioned, absolutely, in addition to some other things, and it is very top of mind. And that's the reason we implored this fourth team outside of our assessment centers, the mobile team, which is essentially about 15 to 20 individuals to be able to do exactly what you just said.
That's kind of encouraging. It'd be nice if we could hire them to come out to even all of our individual office buildings, but maybe that's another discussion. Thank you so very much. Dr. Alex Jahangir, thanks so much for your expertise and for giving us the time here on News 4.